movements and civil society activism in the health sector for the last at least 20-25 years. And we have a large network like we have Abhijit is one of the conveners, and we also have other movements. We have NAPM, which is doing many times. Going to talk to us about that, where many people's movements are already working. So can Aam Aadmi Party, Health Wing and the health movement work together on some concrete issues? This is my core proposition, and I'll present about a few specific points. First of all, next year we have both the Lok Sabha election and the Vidhan Sabha election in Maharashtra. We should develop a health manifesto for Maharashtra. This is my concrete suggestion. A health manifesto for Maharashtra. And we can draw on the rich experience of the Delhi government. So we will not be talking in the air. We will be talking in a very concrete sense, that starting from primary health care, starting from mohalla clinics and a parallel something like that for rural areas, what can be done? So that is the number one solution. A health manifesto for Maharashtra. Secondly, what can be an upgraded urban public health system for Maharashtra? And it can start with Mumbai. Because the mohalla clinic is an example in Maharashtra, almost half the population lives in urban areas. And we know that the situation of urban public health is really dismal. So what is our model? So can we start discussing what is a model for urban public health in Maharashtra? That is something we can do jointly. Thirdly, regulation of private hospitals. The issue which Abhijit pointed out, others also have mentioned that we have no regulation of private hospitals today. So on one hand, patients' rights, and on the other hand, also taking into account the genuine issues of doctors. So we don't want a bureaucratic type of inspector branch type of regulation. We want a multi-stakeholder type of regulation which will ensure patients' rights and also take the doctors' concerns into account. Can we propose a Clinical Establishments Act which is pro-people and also cognizant of at least ethical doctors? Can we formulate that and advocate for that? Number three, massive corruption in the public health system in Maharashtra, exemplified by the crisis of essential medicines. It's today a crisis across Maharashtra. I mean, we give us a few examples where suicides have been committed. It's really a crisis situation. And at the crux is this large-scale mismanagement and corruption in purchase and procurement of medicines. So I think number one issue today to make a political agenda in Maharashtra is औषधा का नहीं है, सरकारी दवाखान्यांमध्ये आज औषधा का नाही आहेत महाराष्ट्रभर. याच्यावर एक व्यवस्थित राज्यभर एक चांगली मोहीम उभी राहू शकते आणि त्याच्यामध्ये आपण एकत्र काम करूया. हे माझे 3 कॉन्क्रीट सजेशन्स आहेत आणि इतर 3 मुद्द्यांवर आपण फक्त विचार करूया. हेल्थ बजेट, व्हॉट शुड बी द हेल्थ बजेट ऑफ महाराष्ट्र, on which already some work has been done. What can be a generalized model of community-based monitoring and planning and community involvement to strengthen public health services, and how can we move towards universal health care, which already Delhi government is doing. I think putting universal health care on the agenda, and I repeat the point, a health manifesto for Maharashtra and a joint health movement for Maharashtra. This is something we can do together if you all are interested.
Absolutely.